Hello, and welcome to the Child Welfare System, an overview for Healthy Families New York professionals for enhanced partnership and collaboration. We are so pleased that you are joining us today to learn more about our New York State Child Welfare System and how we can work together to support better outcomes for families who are involved with the child welfare system. It is not uncommon to enter into human services with many different personal and professional experiences that shape the work that we do with children and families. The purpose of this training is to provide you with an overview of the New York State Child Welfare System and describe how your role in Healthy Families New York will connect. Today's agenda will include an overview of Families First Prevention Services Act and how it has impacted a partnership with Healthy Families New York. We recognize that everyone has varying levels of experience with child welfare, so we will then discuss an overview of the New York State Child Welfare System and strategies. We will consider the many ways that Healthy Families New York and the child welfare system have shared goals. Lastly, we will discuss ways in which child welfare and Healthy Families New York can collaborate and work towards positive outcomes for children and families. With the implementation of the Family First Prevention Services Act, the focus for child welfare has shifted to keeping children safely at home with their families or relatives, committing to reducing lengths of stay for those youth who are in need of placement outside of a foster home, and providing prevention services to prevent placements out of the home. Evidence-based services like Healthy Families New York are key strategies of New York State's Family First Prevention Plan, and it is important that local districts increase their collaboration with Healthy Families New York programs in their area. As OCFS continues its transformation into a system oriented towards strengthening families through implementation of the Family First Prevention Services Act, Healthy Families New York is one evidence-based service that will help us get there. OCFS has made a long-standing commitment to primary and secondary prevention services, including Healthy Families New York and other home visiting programs, family resource and opportunity centers, parenting education programs, and clinical and family strengthening services. These programs are designed to build protective factors within families. Healthy Families New York offers home-based services to expectant families and new parents, beginning prenatally or within 3 months of birth. Family First expands access to tertiary prevention efforts designed to keep children in their homes, and as part of these efforts, Healthy Families New York will provide services to more families, including those involved with the child welfare system by expanding enrollment to up to the child's age of 2. This will be discussed in more detail later in the training. Today, we will be sharing information about the New York State Child Welfare System and how Healthy Families New York and the child welfare system can partner to support families. OCFS's goals are to build a family-centered, equitable well-being framework. The family-centered approach is based on the belief that the best way to meet a person's needs is within their families, and that the most effective way to ensure safety, permanency, and well-being is to provide services that engage, involve, strengthen, and support families. OCFS also aims to develop a public health approach to child abuse and maltreatment prevention by recognizing the impact of social determinants such as poverty, access to community resources, and environment. Another OCFS goal is to deploy evidence-based practices designed to strengthen and support families. The services are provided under an organizational structure and treatment framework that involves understanding, recognizing, and responding to the effects of all types of traumas, and in accordance with recognized principles of a trauma-informed approach to facilitate resilience and healing. Lastly, OCFS aims to invest in New York's families through robust prevention services reflecting the communities they serve, and significantly reduce, if not eliminate, the need to call the state central registry. In order to achieve our goals, it is vital that we embed race equity and social justice throughout the continuum of work with families. New York State is committed to these values and outcomes, and recognizes how bias has impacted outcomes for children and families. We are working to address bias in casework practice and partnering with programs like Healthy Families is seen as a strategy to address long-standing bias within the child welfare system. New York State also supports counties incorporating a blind removal approach to their CPS response, which removes all family and neighborhood demographic information from removal decisions, to ensure that bias is not part of a decision to remove a child from their home. New York State also continues to partner with families and the community, bringing forth the voices of those with lived experiences, and deepening collaborations with state agency partners to strengthen communities through service integration, including their work with the OCFS Youth Advisory Board, OCFS Parent Advisory Board, and the OCFS statewide implementation team. While the terms may be different, the goals of New York State Child Welfare and Healthy Families New York are shared. Healthy Families New York is one of the strategies that supports safety, permanency, prevention, and well-being. Healthy Families New York goals align with New York State child welfare outcomes for prevention, and is a key strategy for prevention work through the Family First Prevention Services Act. Healthy Family New York goals also help to support OCFS's mission towards well-being for all families and children we serve. In 2006, New York State established the Child Welfare Practice Model. The model serves as the foundation on which the child welfare system is built. Outcomes for families focus on safety, permanency, prevention, and organizational effectiveness. All of these outcomes support family and child well-being in New York State. So how do we really do all this work? The family-centered approach entails actively partnering with all family members who will have a role in the child's care. The child's relationships with their primary caregivers create the foundation for a child's well-being for life, and the child and family voice is an integral part of the assessment process. This involves the key element of partnership between natural supports that the family may have, community partnerships such as Healthy Families New York, and New York State Child Welfare. The family-centered approach is based on the belief that the best way to meet a person's needs is within their families, and that the most effective way to ensure safety, permanency, and well-being is to provide services that engage, involve, strengthen, and support families. Key components of family-centered practice include engaging with family members, working with the family to set up goals, strengthen capacity, and make decisions, and providing individualized, culturally responsive, and evidence-based interventions to each family. The child welfare system has adopted the principles of partnership as an integral way of embracing professional relationships. The principles of partnership really aligns with Healthy Families New York values and are the essence of the work that they do. One of the principles of partnership that is shared by both is that all people possess strengths that can be used to improve the quality of their lives. Professionals should respect these strengths and how families wish to apply them. Individual motivation is increased by a consistent emphasis on strengths as they define them. Discovering strengths requires a process of cooperative exploration between the individual and helpers. Focusing on strengths turns professionals away from the temptation to judge or blame the family for their difficulties, and toward discovering how individuals have managed to survive. All environments, even the most bleak, contain resources. Another principle of partnership that is shared is, everyone desires respect. All people have worth and a right to self-determination, to make their own decisions about their lives. Acceptance of this principle leads one to treat families with respect. Trauma-informed approach, solution-focused practice, and reducing the impact of implicit and explicit bias are essential child welfare strategies that OCFS is aiming to improve on as part of New York State's goal of reimagining child welfare. As you will see, Healthy Families utilizes similar strategies with families in their work, and to achieve positive outcomes for children and families. OCFS acknowledges that there are many improvements that need to be made to better serve children and families, and to improve collaboration with other providers. Strategies have been put into place to improve practice and encourage all child welfare professionals to embrace these strategies. We will now learn more about each strategy. One impactful strategy that has been adopted is a trauma-informed approach. Trauma-informed approach is an approach in the social services field that assumes that an individual is more likely than not to have a history of trauma. The trauma-informed approach recognizes the presence of trauma symptoms, acknowledges the role trauma may play in an individual's life, and is designed to prevent an individual from becoming re-traumatized through their experiences within the child welfare system. The trauma-informed approach also recognizes that individuals that work in human service fields are more likely to have experienced personal trauma themselves and are likely to experience vicarious trauma through the work that they do. This is true for child welfare professionals and also Healthy Family New York professionals. The trauma-informed approach asks us to do everything we can to support the family in a way that is sensitive to their trauma history and does not re-traumatize them. It also asks us to explore our own trauma history and practice self-care efforts to take care of ourselves as individuals so that we can be our best in our role as helpers. Another strategy that has been embraced is solution-focused practice. This technique engages with families to identify the strengths and resources that already exist within the family, and to mobilize those strengths and resources to address the problems that are happening. This is consistent with Healthy Families New York strengths-based, solution-focused, family-centered practice work. As we just discussed, everyone possesses strengths, such as personal qualities, traits, talents, and virtues, knowledge of cultural traditions, folklore, personal and cultural pride. These can be used to improve the quality of their lives. Another important strategy that has been implemented in the child welfare system is looking at bias and its historical impact on the New York State child welfare system. In 2019, the data revealed that there is a disproportionate number of persons of color represented at every level of the child welfare system. OCFS recognizes the importance of identifying the root cause of this and working towards change, as bias can, and does, impact outcomes for children and families. Both OCFS and Healthy Families New York recognize that bias can lead to both false positive and false negative assessments, and that it manifests as stereotypes, prejudices, or discrimination and is reinforced through life experiences and mass media exposure. An important value of Healthy Families New York is hiring staff that have similar experiences to that of the individuals they are serving. This allows for more of a mutual understanding and decrease in bias. As professionals, we all must reflect on how bias, both implicit and explicit, may influence how we do our work. New York State is a state-supervised, locally administered child welfare system. The Office of Children and Family Services is responsible for the oversight and monitoring of the 58 local departments of social services, the St. Regis Mohawk Tribe, and the voluntary agencies that contract with districts to provide child welfare services. The local districts are independently responsible for administering child welfare services to those within their jurisdiction, including child protective services, foster care, adoption, preventive services, and adult services, which results in variations in practice throughout the state. Families most often come into contact with child welfare through a child protective services referral. We will talk more about where that referral leads to. However, as you can see, the interaction sometimes continues beyond CPS. If families are in need of further intervention, preventive services will be provided. Sometimes foster care is necessary to keep children safe. Once a child is in foster care, there are different goals, depending on the circumstances. The different permanency goals are reunification, discharge to a relative or kin gap, adoption, or APPLA, another planned permanency arrangement. Kin gap stands for the Kinship Guardianship Assistance Program, designed for a foster child to achieve a permanent placement with a committed related adult, who has been the child's foster parent for at least 6 months. This does not mean that all families come into contact with child welfare this way. Some may refer themselves, or other service providers may recommend that they receive services through a community-based program outside of the child welfare system. Healthy Families New York is one of those community-based programs that families can avail themselves of. Others include family opportunity centers and family resource centers. At all stages of child welfare intervention, ongoing assessments are occurring to determine to what extent child welfare involvement is necessary and what services could be offered to the family for support. Most commonly, families encounter the child welfare system by a call being made to the statewide central register by a mandated reporter or a concerned individual who have reasonable cause to suspect that abuse and/or maltreatment is occurring. Mandated reporters are designated professionals, such as school personnel, police officers, and doctors that are trained in an understanding of what reasonable cause to suspect is. There are over 50 different professions that are considered mandated reporters. Healthy Families New York home visitors are not mandated reporters by statute, however. We will talk more about this in a bit. If the SCR registers the report, it is transmitted to the local Department of Social Services, who will respond. New York State operates on a two-track system: investigative response and family assessment response. Not all counties have both tracks. Based on the allegations and safety concerns, those districts with both tracks make a decision as to which track the report will follow. If an investigation is determined to be the most appropriate response for the circumstances, then a thorough safety and risk assessment is completed, appropriate services are provided, and a determination is made. If FAR is determined to be the best option, then safety and risk assessments are also completed, and appropriate services are provided, however there is no determination. Healthy Families New York is often utilized in each track at the point of service provision. Families can also be referred to Healthy Families New York services early in the investigation or FAR. There are many other services that can be provided, such as substance abuse treatment, mental health treatment, parenting classes, and housing assistance. Traditionally, child welfare uses the framework of assessing for safety and risk as a means of structured decision-making and supporting well-being. Safety decision-making is based on the presence of immediate or impending danger. When conducting an assessment, caseworkers need to determine what safety factors are present. Do they rise to the level of immediate or impending danger, and can they be mitigated in the home with services or interventions? Other factors that might impact the assessment include the children's vulnerability, the age of the children, and the seriousness of the situation. Based on the assessment, the caseworker determines whether the child is safe or not. If the assessment determines that the child is not safe, a safety intervention is needed, one being foster care. A child is only removed from their home and placed in foster care when immediate or impending danger exists, and all other safety interventions are not available. Research shows that the process of removing a child from their natural family is extremely traumatizing on all family members. Therefore, a removal is only conducted when it is necessary to keep the child safe. Risk decision-making is based on the likelihood of future harm occurring and is based on a severity continuum from mild to serious. Risk is assessed using the risk assessment profile. This is a research-driven tool that determines the likelihood of future abuse or maltreatment. Caseworkers also must determine if risk elements can be mitigated in the home with services or interventions. Risk reduction services are then applied to reduce the likelihood of future harm. It is important to remember that safety and risk for child welfare is defined differently than how Healthy Families New York defines safety and risk. The safety and risk assessments help child welfare caseworkers to make decisions with the families related to whether or not to open a case for services, whether or not to keep a case open for services, and whether or not it is likely that a parent will be able to care for their child in the future. Is there risk of future abuse or maltreatment, and is there risk of foster care? Healthy Families New York can be a resource to support a family. Traditional service referrals applied for CPS cases are substance abuse treatment, mental health, and parenting classes. It is important that both Healthy Families New York and CPS partner in connecting families who could benefit from the services offered by Healthy Families New York programs. Services and referrals can be offered, even if a case is determined unfounded. The goal is safety of the child, but also to assist families in getting needed services to reduce that risk. We will now discuss the other sectors of child welfare, beyond child protective services. Our goals for all children are safety, permanency, and well-being. Preventive services play a crucial role in achieving these goals, as they are designed to improve the well-being of the family as a whole and the safety and security of the children in those families. Culturally and linguistically competent preventive services can have a significant impact on supporting families. A child or family may be eligible for other LDSS-mandated or non-mandated preventive services, depending on the level of risk for a child's placement into foster care. A child or family is eligible for mandated preventive services when the risk of placement is immediate or imminent. Non-mandated preventive services are provided at the discretion of the local social services department when children are at risk of placement into foster care, but that risk is not immediate or imminent. Healthy Families New York is one of many preventive services. Some others are daycare, homemaker services, parent training or parent aid, clinical services, transportation, respite care, to name a few. Foster care is intended to provide safe and stable out-of-home care for children until they can be either safely returned home or placed in another planned permanency arrangement. Kin and individuals with significant connections to the child are always explored as options as an alternative to non-relative foster care. Once a child is placed in foster care, goals are identified with the child and family, beginning with the goal of reunification with the family of origin. Healthy Families New York can serve children in foster care, usually working with the parent when the goal is reunification within 6 months. Healthy Families New York can assist with parenting time, help with bonding and attachment. Using the Healthy Families model, this work can continue while the child is in care, mitigating some of those risk factors. Healthy Families New York could also work with whomever is caring for the child in placement. Remember, our family first goal is to help strengthen families with services prior to the point of crisis where foster care may be necessary, and if this is necessary, then keeping children with family or familiar connections whenever possible. Sometimes child welfare intervention is needed to monitor child safety on an ongoing basis following an investigation. Court intervention may be necessary to assist in monitoring of the child's safety if the parents are resistant to needed services. Remember that Healthy Families New York is still a voluntary program. Regardless of what court says, workers should remind families that they are engaging voluntarily in this service, and they can refuse or leave the services at any time. This helps us understand the motivation for families to engage in Healthy Families New York services. The relationship may look very different than a community family choosing Healthy Families New York after learning about it at a community event. As Healthy Families New York professionals, you may be asked to testify in court to the family's engagement in the service if they are court-ordered. Healthy Families New York professionals are well-versed in helping families build protective factors. This is not a complete list of all the characteristics that can be protective factors in the lives of families, but it is a list of critical ones that we all have the opportunity to influence with the families we work with. This collaboration could have many positive effects on a family, as we know building family protective factors and building on strengths and resources leads to families successfully sustaining plans, more long-term commitment to and connection with the plan, problems being addressed prior to returning to child welfare, resulting in lower recurrence and ultimately empowering to families. Think about some ways you support building protective factors. What are some ways that you can collaborate with CPS to support these? Knowing what you now know about the assessments that child welfare uses, how do you think this collaboration could impact the safety and risk assessments? Healthy Families America specifies requirements related to developing a formal collaboration. This collaboration includes development of a Memorandum of Agreement (MOA) between the Child Welfare Program and the local Healthy Families New York program. OCFS has created a standardized MOA for our Healthy Families New York programs that explains length of services, required release of information, and Healthy Families New York Services is a voluntary program. The MOA also outlines that home visitors may remain involved when the child is in foster care, during supervised parenting time, and in case planning. Additional efforts to promote communication and collaboration should be agreed upon at the local level. Staff at all levels should participate in this process and be aware of the formal relationship and what the expectations are for the collaboration. If you have not seen your specific MOA, you should talk with your supervisor about where you can access it. As a reminder, Healthy Families America best practice standards require home visitors, supervisors, and program managers to make a report to the statewide Central Registry (SCR) when they suspect child abuse or maltreatment, though they are not considered mandated reporters per New York State. As outlined in the MOA, home visitors will not share information with child welfare unless there is an active and updated release signed by the family. Healthy Families programs are required by their model developer, Healthy Families America, to utilize releases that are time-limited, include specific details pertaining to what information can be shared, and the requirement that the release can be rescinded at any time by the family. Healthy Families can support their collaboration and partnership with the local Department of Social Services by being familiar with the MOA developed that outlines the relationship and expectations between local departments of social services, LDSS, and Healthy Families. The counties can participate on the local Healthy Families Advisory Board. Healthy Families programs can invite county professionals to tour their building, or invite child welfare staff to meet the Healthy Families teams and talk at unit meetings where supervisors and staff are present. Healthy Families can offer to have materials available in the LDSS office space where families are present. Healthy Families programs can talk with LDSS about tabling in their waiting area to share information with families about the program. What other ideas do you have to strengthen collaboration, partnerships, and build relationships with the county in which you serve? Jot down some ideas and share with your supervisor. For more information on the New York State Child Welfare System and the relationship established with Healthy Families New York, please visit the following websites.